Hello, dear colleagues and participants. In this presentation, we would like to give you information about our study, which includes mixed urinary incontinence patients in which stress is dominant and their quality of life in the midterm after TOT surgery. And two other residents from our institute will go on and detail the study.
In our study, the patients who had undergone surgery of trans-obturator tape within last 5 years in our hospital were included. All had urodynamic evaluation preoperatively. We used questionnaire forms such as Incontinence Impact Questionnaire 7, Urogenital Distress Inventory 6, single comment for perceived state of satisfaction, satisfied or unsatisfied, visual analog scale 0 to 10 for their satisfaction for transobturator tape operation. Incontinence Impact Questionnaire 7 contains questions about physical activity and emotional effect for quality of life, and its score range is from 0 to 21. First two questions in your genital distress inventory 6 are about irritative symptoms. Second two questions are about stress symptoms. Last two questions are about obstructive symptoms.
33 women were included, median age 55 years, median follow-up period 35 months, median numbers of live births 3, nullipar 9%, birth-related complications in 42%. One or more comorbid diseases in 73%, smokers 46%, previous pelvic surgery 39%, antimuscarinic medication in 88%, preoperative median bladder capacity 400 milliliters. 2 of 33 had early operation failure. 2 of 33 had early postoperative post-voiding residual volume of 50 to 100 milliliters. None had urinary retention. None reported to have stress urinary incontinence as preoperatively during follow-up.
60% of them were happy satisfied for having transobturator tape operation, median was score is 10. 40% of them were unhappy unsatisfied for having transobturator tape operation, median was score is 1, as you can see below. Incontinence Impact Questionnaire 7 and Urinary Distress Inventory 6 scores were higher in unsatisfied group, and there was a statistically significant difference between the two groups.
And what we conclude is that unsatisfaction rate is high for TOT performed for stress-dominant mixed urinary incontinence, though successful surgery. This might be due to unmet preoperative over expectations of patients like being dry with surgery for all components of mixed urinary incontinence or failure of us, meaning surgeons, to inform well about the surgical outcomes. There is a need for a larger report on this patient group supported with wide collaboration of multiple centers. Dear colleagues, thank you for your attention.